I was a co-author in an article that was published in one of the PM&R journals, and really what it focused on is to try to highlight important points for a spinal cord injury patient in acute care, and when somebody is initially seeing them on a consult basis, what to pay attention to, and then really highlight the transition from acute care to acute rehab and then to outpatient or home care. The idea was to create this education because there is a lack of spinal cord injury specialists in specific areas of the country, especially rural areas, and those patients still, of course, need high quality level of care. The data that has been published previously really points to a lot of areas where spinal cord injury care is incredibly important when transferring out of acute care. Some of the most important ones are long-term and short-term, what their neurological gains end up being. Some of the aspects also focus on readmission rate back to acute care as well. The other aspects that are really important as it relates to transferring to acute rehab that specializes in spinal cord injury care are their secondary medical aspects. Having a spinal cord injury specialist is really having someone who both understands and anticipates all of their medical and their rehab needs when working with our multidisciplinary team that is also adept in the same. When a patient comes to acute rehab, we do what is called an INSCI or an ASIA examination. That's an international standardized test that helps us to establish both the neurologic level of injury and the severity of the injury. How that's done is testing the patient clinically in a few ways. We test their motor strength, both in their upper and lower extremities, as well as 2 different types of sensation from head to toe. What that essentially allows us to do is in real time evaluate different tracts of the spinal cord and see how they're reacting to our tests. By doing it early on, we can see whether their spinal cord clinically is correlating to what we already see radiographically. And based on the severity, we can also determine what we expect to see going forward in regards to how the spinal cord may start to heal. The most important component initially may be whether there is a complete spinal cord injury or an incomplete spinal cord injury as it relates to what we're expecting in terms of clinical progress. The other reason that it's very important to know both the neurologic level of injury and the severity of their injury is to help the patient and their family anticipate what are going to be their both short-term and long-term needs as it relates to assistance, both in the hospital and going home. Another reason why it's important for patients to go ideally to a place that specializes in SCI care is that due to loss of sensation and loss of motor function, patients are, of course, not able to reposition themselves independently. What that can create is issues with their skin, like pressure injuries. Issues that can take months to years to treat. It can lead to readmissions. It can lead to secondary medical conditions like osteomyelitis. I do think there is a lot of hope along with excitement for spinal cord injury patients. The research is very promising and it's going on in a lot of places, and I'm excited to see what we have available to our patients in the future.